Good
Welcome,
morning.
everybody. Just starting to send out emails, wondering where everybody was here. Okay.
We're here.
We're here.
All right. Let me hear Lisa talk a little bit just to get a level.
Hi there.
Okay. If we can get you a little closer to your computer, whatever you are.
All right. How's that?
Hey,
That's better.
Paul,
Yes.
Lisa has some some pretty good PowerPoint slides she wants to share.
Okay. Can you
So,
email them to me? Or I guess we could share the screen. Yeah, we could just share.
Give her a co-host ability, and she can share it.
All right. Now you got to magically teach me how to do this. Multiple.
Click on Lisa's name, and there's a drop down, and it should say co-host on one of the drop down options.
Stop video chat pin. Make host. Is that it?
I don't think you want to make me the host. Well, co-host works, but it's up to you.
Yeah, I don't see. If I make you a host, I can't switch the stuff around here.
Let's see.
Usually on the more button, you can select co-host.
Co-host, it should be an option.
I see mute, stop video chat, pin, make host, allow to record. That's it.
Okay. All right. Lisa is the host.
Well, and then it can go back to you, and then I can give it back to you, Paul.
Yeah, she'll give it back to you as soon as she's done with her presentation.
Got it.
Oh, there you go. Now you're the host, Lisa. I see it.
Okay, great.
Now you can do anything you want to.
Wow, this is frightening. Anything. I'm usually in control here. This is like. No, she's gonna, and we'll be saying, "Give us it back." No, I'm in control here now. Right?
Paul's got a control issue here.
I have a control issue. That's definitely true. All right, so let's get this thing rolling here. We're already waiting on Facebook. Let's start YouTube here, and we'll get this thing rolling along here.
All right.
Okay, everybody be quiet. Here we go. Hey, welcome everybody. It's time once again for another episode of Health Talks with Dr. Trin. It's the one show, maybe the only show, that shows you all the ins and outs of health today. How to find that way through the facts and the fiction to the truth that will keep you healthy today. With our main truth teller, Dr. Trin. How are you, sir?
Oh, man. Truth teller. Wow, that's a new title.
Yeah, well, we've called you a soothsayer. Maybe you're just a truth teller. You're the one that tells truth to power here. You're the one that's going to tell us what the facts are from the fiction.
Oh, geez.
No pressure there, right?
No pressure there.
Well, the fact is you brought a great guest with you today. Oh, my goodness. I don't think we've ever had her on any of our shows, and we've always wanted to have them on. So I don't know how you did it. You're connected. But for your community today, you got a discussion you brought. Is it Lisa Jenkins? Is that, am I saying it correctly here?
Correct.
And you are, give us the title because I'll blow it. This is on the Council on Aging, right?
Yes. So I'm the president and CEO of the Council on Aging, Southern California.
And are there other Council on Agings? I always see brought to you by the Council on Aging. It sounds like a giant organization here.
Yes. Actually, there are a lot of Council on Agings. Oftentimes, they're locally based nonprofit, which is what we are. So we're a locally based nonprofit based in Irvine. We're located just across the 405 freeway from John Wayne Airport.
Okay.
But there's also a National Council on Aging. So it operates independently. It's based in Washington, D.C. So there's a number of independent operating.
And what does the Council on Aging do? Do they just count old people as they get older? Do they give us help? What's the Council on it? Do they just say, oh, they're getting older?
We provide all sorts of help to help older adults stay healthy, connected, and protected. And we're a great resource for families as well. So as a locally based nonprofit, the majority of our programs are offered at no cost to the community. We cover a 5-county service area. So we cover Orange, Riverside, San Bernardino counties, and then also Inyo and Mono counties up in the Sierras. We serve about
Inyo, and
200,000.
that's not Southern California. Inyo County, that's way up there somewhere. Yeah.
Where is that?
Well, that's part of one of the government grants that we manage, goes all the way up there. But we serve about 200,000 seniors annually.
Wow.
With an array of programs and services.
So what do you do? To give us, we give you a couple minutes here to toot your own horn here and tell us all about the services you offer here.
Okay. Well, I actually have a slide that actually shows.
I knew that, and I had to surrender control of this show to you temporarily. That's very uncomfortable with that.
You gave me the power. So let me share my screen with you, and I'll show you what we do, because we do a lot of things to help seniors stay healthy, connected, and protected. So let me show you what we do.
Okay.
Let's see. Here we go. Okay, so here's a little bit about us. Typically, when we're not in the midst of COVID, we'd be operating out of 94 locations because we have a presence at senior centers with our health insurance, counseling, and advocacy program. We provide those services there. Now we do that virtually, of course, during COVID. We have about 82 employees and over 400 volunteers. And most of our volunteers are retirees themselves. So they're looking for meaningful work in retirement. A number of our programs require training and state certification. So if you're looking for a volunteer opportunity that might be an hour or so a week, we've got that, not extensive training. And then we have some that are much more.
So let me stop here for a second. 94 locations. Give me some examples here in Orange County locally.
In Orange County, so we have our office in Orange County and Irvine, as I mentioned. There are about 34 senior centers in Orange County, another 30 in San Bernardino County, and another 30 in Riverside County. So there you are, right there. And then, of course, there's up in Inyo and Mona counties, we have a location up there that we operate out of. So an extensive network that puts us right in the middle of where older adults are coming.
And somebody already asked a question here this morning, and they want to know, what has happened to the senior centers during COVID? Are they all shut down? Are they providing pickup services for something? I don't know.
Yes, they are. Some of them are providing pickup services. Many of them are for Meals on Wheels. So that's a pickup location. But there's some that are starting to open and provide services. But by and large, they tend to be closed now and are offering classes virtually.
Okay.
Services virtually.
All right. So in
that's
these,
to keep these older adults protected.
In these 94 places, give us some examples of some of the programs that you run or bring out.
All right. Well, let me show you. So here's some of the programs that we offer in the community. So HICAP, that's one that's at all these various senior centers, is called the Health Insurance Counseling and Advocacy Program. And it helps Medicare beneficiaries maximize their benefits and minimize their costs. So we help educate the community on how Medicare works and how to make it work for you. We do not sell any plans. We don't promote plans, but we help beneficiaries understand how to choose a plan that works best for them and to maximize their
So can I give
benefits.
you a silly example of why that's needed?
Sure.
My own wife turned 65 a couple years ago, and she was employed. So she thought, I don't have to apply for Medicare. I have private insurance. I'm going to save Medicare some money. I'm a good citizen. Why would I start taking Medicare? I don't need it. And when she finally applied a couple of years later, she's penalized. She's got a penalty. And we've just been telling the world this. Sign up when you're 65. If for some reason you think you're being a good person or you don't need it, don't go there. You got to sign up or you get it. Why do you get a penalty, and why don't more people know this?
That's a great question. Well, I'm not sure exactly how the penalty came about, but it is true. And a lot of employers don't even know this to advise their employees about that. Right. So one of the things that we do is we offer, you can see in the education and outreach section, we offer roadmap to Medicare classes. So when you're about to turn 65, we encourage you to take a class. We offer it via Zoom now, and to help you learn how to navigate the complexities of Medicare and avoid the penalty. Exactly.
I'll give you a second thing. So this year I turned 65 and I signed up for Medicare, and I'm thinking, oh boy, I can drop, because I'm, have private insurance through the, whatever they call the Obamacare market. I forget what it's called here in California, but wherever you go buy the exchange, wherever you go buy private insurance here. And so I'm thinking, great, I don't have to buy insurance anymore. It's free now from Well, the Medicare Advantage plan that administers this might be free, but I still have to pay for Medicare for the rest of my life. I think it's $147 or something like that. Now,
Yes,
that's
yeah.
not the end of the world, but I didn't know that. I thought Medicare,
Right,
once
right.
it starts, is 100% free.
Yeah, no, see, that's one of the reasons it's important to really be informed about Medicare. So we encourage Medicare beneficiaries to touch base with HICAP every year, particularly around the annual enrollment period when you can change or modify your plans or maybe change a prescription drug plan if that's the type of plan you have. So you can check in with us and we can help advise you. It's a free service. This is funded by the federal government. And so we're happy. So there are HICAPs all throughout California. They are also located in other states as well, but in other states they're called SHIP, in SHIP, but here in California they're called HICAP.
Okay. All right. Last question on Medicare, and then
Oh, I
let's
think Dr. Trin had a
go
question
ahead.
here.
Jump in. You got one
My,
too?
my guess is that 95% of folks have never heard about the word, of the words high cap.
No, we got to get Dr. Trin much closer. He's very soft here today. I don't know why he doesn't want to be loud and
Yeah, I'm just saying that my guess is that many people have never heard of high cap. And so this is great to hear about this.
Yeah, so we appreciate the opportunity to talk about this. We don't have massive marketing budgets, at the Council on Aging, but we do our best to get the word out there using social media and all sorts of other venues. But being in those senior centers is a big plus for us. So HICAP's well known at the senior centers.
well, we're gonna tell everything, and I'm gonna give my last little question here about Medicare. I still don't grasp why Medicare Advantage plans came about. These private plans that will administer. Is it just Part B of your Medicare, the part that handles health or drugs and
Part D is the drug portion.
yeah. So what? And they keep saying, and they kept trying to say this as I sign up. You can keep regular Medicare from the government, and you can go anywhere you want, or you can sign up for these Medicare Advantage plans. Costs you nothing extra, but now maybe you get dental and you get eye
Some other
care,
benefits.
but you're now in a HMO or a PPO. You're in some sort of group or something, and everybody says, "Which do you want?" And I'm like, I don't know. And most people seem to pick the Medicare Advantage plans. I did, but I don't. I wish I knew there was something like this. I'm just sort of flipping in the air, saying, I don't know what's the difference. Why should I pick one versus the other?
Well, you need to come and visit with the
I do.
HICAP counselor and
your
help us
candidate.
explain this. Help us explain this to you, because in Orange County there are over 44 Medicare Advantage plans, and there are
Wow.
another 25 prescription drug plans. So if you think when you're at work, okay, I have to choose between a couple of plans, and how do I choose the one that's best for me? And now imagine being an older adult, 70, 80, 90, and you're trying to figure out which of those plans is best for you. And the interesting thing is if you're working with an insurance broker who plays a very important role
Right.
in helping people decide, they offer a limited number of plans. They
Yeah,
don't offer
right.
all the plans.
Right.
So by coming to HICAP, you can understand what is the whole array of options that are available to you. And then we can help you zero in on some plans that might really fit best for you. And then you make the final decision and you contact your broker.
I am
you
the
contact
poster child. I wish I'd known it was there. I'm your target audience, and I can
You're
see
the
the
man.
need. I'm it. All right. So what else do you do other than
Okay, so-
help us on Medicare?
Well, one of the other things that people often think as they go on Medicare is going to pay for my long-term care in a
Yes.
nursing home or
Oh,
assisted living, right?
Right.
A lot of folks think that, and that's actually not the case. So not only can you learn about that through HICAP, but you can learn about our ombudsman program. Our ombudsmen are advocates for residents in long-term care facilities. So we not only advocate for residents, but we investigate complaints. And normally our residents are out in the community, or pardon me, our ombudsmen are out in the community, walking the facilities, making unannounced visits, checking on the residents and advocating for them. So we could be investigating a complaint that could be my call button isn't answered when I push it, to very serious cases, or I'm being sexually assaulted by my caregiver. So last year we investigated in Orange County over 400 cases of complaints regarding abuse and neglect.
Wow.
And so this is a very important role. So we provide this service in Orange and Riverside County. Ombudsmen are located all throughout the nation as
how do
well.
we find them? Through your site? If I want to,
Through our site, yes, I'll provide some information on how to contact us.
all right, you're hitting all
phone.
my hot buttons, so I got to tell you another story or two here. So,
Oh, please do.
over the last couple of years, my late mother, then my late father, and then my late aunt, my mother's sister, who never got married. I'm an only child. Lucky me, I got to go through this 3 times here, as they all got older and went into nursing homes and whatnot. It was a nightmare for those who
Yes.
haven't been through it. Trying to navigate, number one, how to pay for all this stuff. Oh my
Exactly.
goodness, we weren't ready for this. They were all living out in the Palm Springs area. The average cost of just a basic assisted living facility starts around $4,000 or $5,000 a month, and it's out of pocket. Who has $4,000 or $5,000 extra a month? I don't. They didn't.
Yeah.
So we're trying to figure out other options, these group homes and other sorts of things and whatnot, and what services, if any, they qualify to have people come to. My dad was a veteran. We found out much later that he, qualified for certain services where they'll come out and to your house and stuff. It was a nightmare, and the people I expected to teach us wouldn't touch it. The hospitals and the doctors we went to. Sorry, the Dr. Trins, you're going to have them answer this. But when we started saying, what do we do? They went, I don't know, but they can't live at home anymore. Figure it out. Well, what do we do? Well, we'll shuffle you off to some, I don't know, administrator person, and they give you options and And I kept saying, but what? What would you do if this was your mother? And they'd go, can't tell you, can't get involved, can't recommend anybody, can't tell you one thing or another. Here's just some basic information. Go figure it out. I think the system is broken, and I applaud that you guys are trying to go out and educate people. What do you think about that, Doctor? When the child, the old child comes to their old doctor and says, "What do we do?" The doctors just throw up their hands and go, "I don't know, figure it out."
That's absolutely correct. Because, I mean, we don't learn this stuff in med school. Like, we don't know anything about, the cost of nursing homes, what's covered, is it paid for by Medicare or Medi-Cal, and how do you qualify for it? None of us, most physicians, have no clue.
We still got to get you to speak up. For some reason, you're real soft on this. Yeah.
I'm just a soft guy today.
You're a soft guy here today.
But yeah, so most of us don't have a clue on is this covered by Medicare, and if it's covered, how long it's covered for, and how much funding is there. Are you kicked out at a certain time, or
Yeah, right.
no?
I said, what happens if, so we put them in, and and lucky them, they outlived their money, and now we got to go. They said, you got to go. And so my 99, we're going to have to kick them out. In fact, it was worse than that. I found that the doctors were embarrassed to discuss it. Like, ooh, I'm the doctor. Let's not get into money and figuring out. They would lecture me on how I needed to do something, and I'd say, what? And they'd go, well, I don't know, figure it out. They didn't give me any guidance whatsoever. It was like a topic they didn't want to talk about, and I don't know, there must be a resource. Not one of them ever said go to the Council on Aging. I wish they had.
Well, one of the things that I'm going to talk about in a minute is a new program that we've developed called Concierge Care Navigators, which actually addresses the exact problem that you're
Perfect.
Talking about. So,
let
me go back to just to finish what we do in the advocacy and protection area. So another important things that we do is we have a senior protection program. And you've probably heard a lot about the scams and financial fraud that's happening with older adults. It's prevalent today. Billions are being stolen from older adults. And unfortunately, many times the perpetrators are family members themselves.
Yes.
So one of the things that we do is we provide outreach and education to help older adults and family members understand how to protect themselves from fraud, protect a loved one from fraud, and should as fraud occur, that we can also refer them to resources to help them address the condition. So that's an important program that we offer. Also in the education and outreach area, we have an answers guide. This is an online resource to help seniors and their families just navigate the aging process. So it's got all sorts of articles and content, all online, easily accessible from our website.
So I'll keep periodically interjecting my own personal stories here.
Do.
So as my father, big, rough, tough guy who came out of the Depression, rose to become a corporate executive from working on the assembly line, fought in World War II, a tough guy. As he got older, he was like a little kid. I had to wipe his butt. I had to, tell him what to do as he's getting old and confused. I wasn't ready for that role reversal. He told me what to do. Yeah, he ran our life.
Yeah,
now I'm running
right.
his. It was very embarrassing for him and me both here.
Yeah, exactly. And I think it's interesting as we think about our lives, we do a lot of planning. We plan to go to college. We plan to get an education. We plan to buy a car, buy a house, get married, all these things. We don't plan for aging. We don't want to think about it. That's going to happen at another time.
Absolutely.
Don't talk to me about it. My health is never going to fail.
Right.
But all those things actually do happen. So as adults, we should be responsible for thinking about our own care and how do we enable our children or our loved ones to help us live the life that we want to in retirement. But by not talking about it, it's not going to go away. I mean, aging impacts us all totally.
And so we saw
have
that
to
in
understand
spades,
how to.
yeah. I wish there had been a place. Again, you were around. We just didn't know about it. So we'll talk about that at some point of how do you get the word out. You obviously,
Sure.
you said limited budgets. Why? Just talk about that for 1 second. The only place we know to go are the health providers, or when you're in the hospital. Suddenly, then we got to start talking about this. We haven't talked about it. We haven't learned about it. Now, in a crunch, there's an emergency. Mom or dad is in trouble, and we got to figure something out. Why are the healthcare system providers so maybe inept is a hard word, but not really ready to go there? They just sort of give you a little generic thing, and they just really tell you to go figure it out on your own, kind of. They give you very little guidelines.
There are challenges where they don't want to, endorse or recommend someone. So they oftentimes give you a list.
Right.
But if you are dealing with this list in the middle of a crisis, that's not helpful.
No.
Right. And sometimes some of the resources on the list maybe not be such good resources.
Yes,
so because they're not vetting them and checking in on them. And so this is where it's important that to reach out to the community and find out what resources are available. And actually, in our communities here in the Southern California area, there are lots of resources. And so, but it's important to be informed about them before the crisis occurs. And so that's why we really urge having what we call a heart-to-heart conversation, talking with your loved one about how do they want to live their life in retirement and what should happen if there's a health issue where they're no longer able to take care of themselves. And usually it's not one conversation like let's have the big heavy discussion, but rather it's multiple conversations over time.
Yes.
And making it be an acceptable topic and offering how you can help. How do you help them live the life they want to lead?
This kind of information should be part of some kind of onboarding process.
Yeah.
So if you turn 65
yes.
or you come to your doctor's office, this should be onboarding. Because this is so much valuable information that none of us know where to go to.
It's a strange way to put it, but it's true. You are boarding the last ship, the last journey here, and there should be a passport, and there should be a class on all this stuff. Because if otherwise you're waiting for a crisis to happen. In the midst of a crisis, you got none of the things you rely on. You have no information. You're emotional and you're upset. They're emotional and they're upset. So you're not making good rational decisions. You have no good basis to make the decision. Nobody's advising you or telling you or whatever. And it's a crash program. They're getting kicked out in 2 days out of the hospital here. They got to go somewhere and do something here or whatever. 100 other issues like that.
Right. What actually, in mentioning that topic that you just mentioned, they're getting kicked out of the hospital in 2 days. There's actually a Medicare rule where you can delay a discharge for up to 3 days. Most people don't know that. They're in a panic thinking mom and dad's going to get discharged. You actually can delay that discharge. And so that's an important fact to know. And the hospital should be telling you that, helping you understand in advance that you don't have to rush out and be discharged immediately.
Well, we didn't. My parents were in and out of the hospital over 20 times, various issues, conditions. My mother had Parkinson's and was falling. My dad had a leukemia. My aunt had a rare form of blood cancer. All these things, in and out of hospitals all the time out there. And usually, quite often, a fall or some crisis. And then they got to go somewhere now. And it was not you got 3 days to figure this out. It's like, you got till 2 o'clock this afternoon. We're discharging them.
Yeah,
Or
no,
they're going home.
you can stop that. You can stop that discharge, and that gives you more time to evaluate skilled nursing facilities if they have to be sent to one of those. And that's particularly important during COVID. If someone is being
Yes.
discharged, you want to make sure that COVID is not rampant at the facility that you're sending them to.
What are you
So-
seeing? Let's take a quick aside on that, because I just saw this morning in the New York Times that nursing home deaths are down. Have we got a better handle on this, Dr. Trin, out there in nursing homes, or is it still running rampant and getting people sick and killing people?
In general, the number for COVID in the United States, as far as new cases and hospitalizations, is cross our fingers, coming down. That's what we're seeing in a positive trend in the last few weeks, that the numbers are improving. I'm in the ER admitting patients on a regular basis, and I can tell that the numbers are improving.
What do you see, Lisa? You got any stats, any
Oh,
figures?
definitely. Well, I'm a member of the Orange County Healthcare Agency's Vaccine Task Force. And so we're definitely seeing the trending downward. I'm very encouraged by that. Also, we're doing the vaccinations are occurring in long-term care facilities. So that's almost, we almost have all of the residents vaccinated who want to be vaccinated, staff members also. So that's coming along very nicely. There's a huge effort by CVS and Walgreens coming into the facilities to vaccinate folks. So I'm encouraged by that. But until we get herd immunity, we've still got a long way to go. But all of the signs are pointing in the right direction. And I think the Orange County Healthcare Agency has done a great job of trying to move this out into the community, get these folks vaccinated. Biggest challenge is there's just not enough supply, and that's starting to change also. But a lot more to happen in the coming weeks and months.
All right, so we won't go down that rabbit hole of whether the county's doing a good job or a bad job. We've addressed that a couple of times. I think they weren't doing a good job, by the supervisor's own admission, in the first few months of this thing here. Athena wasn't ready, hard to get on, hard to get information, but the anecdotal evidence we're hearing is it's getting better, it's getting through. I myself got vaccinated, and it was quick and easy at SoCA. So I think, yes, we're making ground on that.
Did you have a good experience at SoCA?
I did, and I will tell you again. I don't know how many stories you want to hear from me here, but I was one of those really not too happy about the way the thing rolled out, as many of the people on this group were.
Well, look at what the federal government did. We did not have a good plan to roll out nationwide something of this magnitude. So all the states were jumping as fast as they could. It was very difficult.
So when Athena hit, we all thought, okay, good. Here's an app. We'll all sign up. First, you couldn't get on, and that was crazy. And then when you got on, didn't tell you anything. And it didn't communicate. My biggest complaint is it didn't communicate with me. I understand it takes a while to get it, but I thought they would send me updates. They would send me something, even if it was just an estimate. But I had to, like everybody else, every day go check it at random times to see if I could get in. And it felt like, this is a silly analogy, but it's like the old Seinfeld show, The Soup Nazi. No soup for you today. Sorry, no soup for you today. And then I would come back, and about a week or two ago, I just went on randomly during the day as I was doing, and then it said, if you can get here in an hour, you can get it. And I thought, okay, so again, I had to drop everything, no advance. So here I am, and I rushed down there. Now, having said all that about the unhappy experience with the app, when I showed up at SoCA, very well organized, extremely, everybody's nice and helpful. You stayed in your car. You showed them your thing. You went and from start to, they said get there half hour early, which I did. From including that half hour getting there early, it only took another half hour to get through the whole thing. It was quick. It was easy.
Good. Yeah.
And I got to tell you, and this is I hate to admit this because I'm trying to be a big tough guy too, but when they finally gave it to me and they looked at me and said, okay, you're all set, Mr. Roberts, I started to tear up, and I thought, thank you. Oh my God, thank you. And they kind of patted me on the head. Okay, old man, you can go on now here. And I just thought, it was very, I was very impressed how the whole thing was handled. And unlike the horror stories I heard of 3-4 hours and confusion, no, not here. Oh, you didn't bring this, go home. I hear all sorts of earlier problems, mostly with Disneyland, but not with the SoCA one. Very well organized, very well run. And finally, I got a feeling that maybe this is under control here.
Sounds like you felt confident after you got there and you got that shot. That
I
okay,
did.
you have your second shot scheduled, I imagine.
I did for the first week of March, and I don't know how that's going to happen, if they're going to communicate with me, or again, if I have to just go start pushing the button and saying, come on, I'm supposed to be
No,
doing this
if
now.
you have your appointment, that should be
Yeah.
fine. There could possibly be a delay because we had a delay in vaccine shipments. So just be checking in on Athena, but that you should have everything you need to move forward.
And I
So,
got the Pfizer one, and boy, if we had people. We did one show, Dr. Trin. I think Patty and some others on here were talking about this, the hard kick to that Moderna one, the second one. I just had somebody the other day tell me they got the Moderna one and they're feeling sick. That I don't know why the Moderna one. Explain that again, Dr. Trin. Why does some give you a heavy kick on the second dose and others don't?
It's very individualized, and it's based on how our immune system is. Good immune system, bad immune system, underlying inflammation in our body, all that kind of plays a role. But Lisa, tell us about education and outreach.
Yes.
sure. So one of the things that we also do from an outreach perspective is the Smile Makers Holiday Gift Program. So, I talked about folks that we advocate for in long-term care. Well, here in Orange County, there are 28,000 older adults in long-term care facilities, and half of them have no friend or family member actively
Oh my
involved in their
goodness.
care.
Say that again.
Half.
Say that again. I want everybody to
So
sink in.
half of residents in long-term care facilities, and this isn't just in Orange County, this is nationwide, have no friend or family member actively involved in their care. So they may have a family member that maybe lives at a distance, or even one locally, but they're not coming and visiting them regularly. If you've ever been to a long-term care facility,
Yeah.
you'll be struck by how many folks are just out in the hallways, just hoping someone will come by and speak to them, right?
Absolutely.
The hallways are not flooded with family members, visiting their loved ones. And so it was through this that about 25 years ago, our ombudsman realized that at the holidays, many residents did not get a holiday gift of any sort at all. They were completely forgotten. And so that's how the Smile Makers Holiday Gift Program began. And so with the help of the community, we reach out to local corporations, employees, and groups with a little angel tag. And on this angel tag is the name of a senior, their age, and the gift that they'd like to receive. And it's always something simple. It's a lap blanket, it's pajamas, it's a sweatsuit. And then these gift tags go out to businesses all over and groups all over the county. People go out and purchase these gifts. They come back to our offices, or we pick them up at different locations. And then we create a giant, looks like Santa's workshop, with tissue paper, wrapping paper, bows, everything. These gifts go into a box with tissue paper and wrapping paper and so forth. And then we tag them and we deliver them back out to that senior just in time for the holidays. And one of the things we found is that we could use gift bags. That'd be a lot easier. But we like to use boxes and ribbon and so forth, because
Open it, yeah.
You can remember that, as even as you get older and you're struggling with dementia, you can often remember the concept of a wrapped gift with your name on it. And so it can bring back that incredible joy that you felt. So last year despite the pandemic wasn't stopping the Smile Makers. We collected, wrapped, and delivered nearly 6,000 gifts to seniors in long-term care facilities. And so it is absolutely the heart of the holidays for us. It's a wonderful,
All right,
wonderful
let me
program.
give another shout out here to one of the people on line here, John Gutierrez at OC Hospice, another organization. I don't know if you guys work with or coordinate or whatever.
I'm familiar with them, definitely.
And I just, again, another example of how these people are alone and abandoned. So when my late aunt died a couple of years ago in one of these facilities, they called me. She never got married. I'm her only living relative out here, and she's 2 hours away. And they said, she's going. So I got in my car immediately, dropped everything, and to be there with her at this moment. I got there about an hour before she died. And they looked at me with such shock, and they said, is this your mother? I said, no, this is my aunt. Your aunt? And I said, well, yeah, what's wrong with that? They said, why are you here? I said, what am I here? She's dying. And they said, nobody comes. Nobody ever comes. And I was like, nobody comes? They said, no, that's what we're here for. And only people who come are the hospice people. There was a hospice worker. I'm going to get choked up here, but they come and sit with them quite often because nobody is there. Talk about the most frightening thing in the world. You're gonna leave this world on your own, frightened in a room with a bunch of strangers. Oh my
Yeah,
goodness. Yeah.
Uh,
very, it's,
what is wrong with our culture and society that
Really?
we just don't value our older folks, our seniors, and those who have gone before us? And
No.
it just kind of surprises me, actually. I mean, when you go to other countries,
Particularly in Asia. Yeah.
Asia, there's no
Latin
nursing home
America.
because mom, dad, grandparents, multi-generation, they live together and they just kind of take care of each other until you pass away. But our culture is so different than that,
The
and it's
culture it's antiseptic. One, because we're the Peter. This is my theory. We're the Peter Pan generation, as Lisa alluded to. I'm never going to get old. It's never going to happen to me. I don't want to hear about it. It's negative. Blah 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 blah. And so when it does start to happen to somebody we love, we tell ourselves they'll be taken care of, which means they'll be taken out of view. It's like the way they clean Disneyland at night. Somebody come out, you don't ever see the workers cleaning Disneyland. You don't see people, old people. They're taken away. They're warehoused somewhere. We tell ourselves they're taken good care of, and then we block it out of our mind, and we don't know what to deal with it or how to deal with it. People don't.
that's where I think we have a chance to change that, dynamic. I think we have a chance to, and interestingly, I think COVID has brought a highlight onto the issues facing older adults and the isolation for those in long-term care facilities. And I have an exciting new development at the council that I'm going to share with you in just a second.
Okay.
That I'd love to talk about. But before we move on, I have a couple other programs to tell you about. We have a Reconnect case management program. So for older adults who have become disconnected from the community, maybe they've lost a spouse, they're struggling with a chronic health condition, we can enroll them in our Reconnect program. It's a one-year program. They're connected with a case manager. They get involved in activities so that they can learn anything from how to participate in topics that they've been interested in before, maybe art classes or outings or activities that can engage them again. They learn how to utilize public transportation if necessary. And then they graduate from the program having attended support groups. And if they need to see our geropsychiatrist, we can organize that as well if they're struggling with depression. So it's a wonderful program. And so they graduate and they're reconnected again and back as valuable members of the
So let's explore
community.
that for a moment here, because now you hit another high. I'm going to get on my high horse again. I don't think the seniors are connected. The seniors next door, you don't know. They're shut in. Nobody goes to talk to them. The seniors in these homes certainly are taken out of they're out of the mainstream now. Nobody goes and visits them. I don't know that they're there. And I wonder if, again, as a society, we shouldn't be trying to utilize, they've talked about this a lot. I'm not the only one who's come up with this idea, using seniors as a resource and not just as, this is a hard way to put it, dead weight that we're just sort of planting somewhere and taking care of. So, for example, could they get seniors to come to these senior centers and they integrate daycare classes? So they're the grandpa to these little kids.
Yes.
That
Exactly.
kind of stuff, or
That's
reading to kids and doing other things.
right. Yes, that's been definitely happening around the world. That's a wonderful ideas. Of course, during COVID, we're really trying to keep them protected. Unfortunately, those that have been isolated are more isolated than ever. So I've got something that we've been working on that I'll share with you also in a minute. We do have also a friendly visitor program this is a great volunteer opportunity for about an hour a week to either, when we were able to go and visit a senior, but now make reassurance calls with them. And so you develop really wonderful bonds between older adults that tend to be either homebound or bedbound due to health conditions.
I'll stop you for one more second. Not on Dr. Trin's show. We should get him on Dr. Trin's show, but on one of our other shows, we had one of the people who runs, I guess there are two Wheels on Meals programs in the county here. Not the one from the south, but whatever the organization that runs it from the north part of the county. And
Meals on Wheels, Orange County, it's called.
Yes, there you go. And so she was talking about this, and she said, what I have seen in my own aunt's life, there is nobody checking on them every day. Nobody stops by or calls them. I tried to call my aunt once a week. I should have called her, I guess, every day. But the Meals on Wheels person was the only person when she was living alone.
That's exactly
at home.
right.
The only human being that knocked on the door and said, "Are you okay?" And I thought, wow. I mean, just on a basic level, we don't even know if these people are alive or dead in those places.
That's why it's so important to, make those visits. I have to tell you just an anecdotal story. When I was 14, my first job ever as a volunteer was I was a candy striper in a nursing home. And what struck me most in all the summers that I worked there was how many people with cognitive ability would say, oh, my daughter's coming today, or my son's coming today. And day after day after day, those daughters and sons never came. And this was a nice facility. These folks had family members, but they just didn't show up. And at 14, that had a profound impact on me. And I would go to my parents and like, how do you not visit your parent? I don't even understand that. And so I spent most of my life in the private sector, working in international business and building corporate coffers, loved it for a while. And then I thought, wait a minute, what am I doing with my life? I really want to give back to the community. And when this opportunity came along, I mean, this is really near and dear to my heart. And I feel that we can really make a difference in the lives of older adults. So I'm really passionate about how we can change their lives and make it better.
So I'd be curious.
Part of that is speaking to groups like you so that we can spread the word.
I'd be curious, Dr. Trin, to get your audience to react. Let's be honest here for a moment. Why don't we want to go visit these people? Is it just us? Are we just horrified, can't handle it? We're little children. We don't want to see it. We don't want to believe it. We don't want to deal with it. Or are there other barriers? I mean, it's not easy. I guarantee you. I just remember while we're getting some feedback, why do we ignore the seniors? Why don't we go visit our own families? Why don't we go visit our own grandparents? I know it isn't easy. When I remember when my aunt would be in a facility and like even just she'd fall, we'd take her to the hospital, and then she'd go into some skilled nursing facility. And always in the skilled nursing facility, there was some residents there who never left. They were long-term care for whatever Medicare or something or whatever there. And I just vividly remember two people that I'll never forget. I don't know their names, but I can't get their images out of my head. One was a gentleman who apparently, I don't know what his situation was. All he would do is sit in the room and shout, help me, help me, help me, until he'd get hoarse. And then he couldn't shout, and then he would start up again all night, all day. And of course, what did everybody do? Nobody helped him because they were just, would you just shut up? And so they ignored him almost as a penalty, like a little, and the more they ignored him, the more he shouted. I'll never forget that. And then the other one, I'm out and the lobby leaving, and a woman is on the front, out in the front chair. Somebody had taken her outside, and she said, help me, I want to go in. I said, well, they just left you out here? Well, yeah, because there's a crisis. There's an emergency. There's too few staff. There's 100 people buzzing. I'm not trying to say the staff is awful and evil, but they're understaffed. They're overworked. They're frustrated. Everybody's screaming for help. Everybody's hitting the buzzer every 2 seconds. And they start to ignore these people. And she sat out there for like an hour. And I finally said, well, here, let me help you. And then everybody's horrified. You can't help her. You'll get sued if she falls. What are you, nuts? And I'm like, so we just let her sit there until 2 hours go by and they can finally get to her? I mean, there's something wrong with this whole system that I get it, that these people are just overwhelming and can drive you crazy. But the answer isn't just to let them go crazy and let them sit there. I don't know. Any reactions here? Why are we all so hesitant to go there? And
I think because we don't know what to do. We can't imagine a life where we're now in charge of caring for our parents, where we didn't talk about it. We don't know what to do. And so we often think we have to do it alone. We don't know where to start. And actually that's how we developed our next program, Concierge Care Navigators.
Okay,
so I like to think of it as aging reimagined. You do not have to go it alone. We can work with you. There's resources here, free resources, paid resources that can make the journey easier, but it's about being informed. So let me tell you about how this got started.
Okay.
This is an idea that I've had for a while, having gone through caregiving myself and with my family, and then also just seeing the number of folks that need help, that call us for help. And I was actually inspired by one of our Smile Maker volunteers who got into her late 90s and did not have family or friends and really struggled at the end of her life. And we jumped in and helped her. And from there, I thought, okay, what do we learn from this and how can I help others? And so that's how Concierge Care Navigators was born. So this was funded in part by the Orange County Community Foundation, local family foundations that wanted to invest in innovative ideas for local nonprofits. So we secured some significant funding to go out and actually buy a local, very well-respected geriatric management firm. And we bought this organization, brought on registered nurses along with it. The registered nurse, Carrie Boos Baker, that owned it, became part of our team. So this is led by registered nurses and a gerontologist, and we focus on enhancing the lives of older adults through developing online personalized care plans with their physicians and healthcare providers that can provide peace of mind and confidence that you can navigate the aging journey together and that everybody's on the same plan. And it's the thing that's unique about it is that it's an online plan. So if you have family members that live at a distance, maybe you have a daughter in Seattle and there's a son in Texas, they all know what the care plan is. They understand how mom or dad is being cared for. All the data is in one place. You go to see a new doctor and the doctor's peppering you with questions. What are the medications? When did they take them? When did they stop them? All of that's in here, along with medical and non-medical goals. And then our nurses work with the family to help implement those goals.
So Dr. Trin's favorite thesis is that telehealth is here to stay, and that it, rather than being, some people say, well, it sounds like I'm getting gypped. I'm only getting 5 minutes on a iPad. It's like, no, maybe you'll get a half hour with the doctor instead of 5 minutes in their office, where time is really short, and maybe, or others. It sounds like that. Talk about that, Dr. Trin. It seems like online telehealth. I understand this is an older community. They may not be comfortable online, but they're getting comfortable online. They're doing Facebook chats and other things.
I'm doing telehealth now, and the majority of the folks who come to see me on telehealth are older than 65. And this pandemic has brought out the value that we see in telehealth. Imagine the process of initiating an appointment to see your doctor and the entire process of getting in to see your doctor. And it starts with a phone call, and you're put on hold and you're waiting. And then you got to find, a schedule that's convenient for the doctor and you. And then you move on to looking for transportation.
Yes.
Huge. Right? You have to, get a shuttle, a bus, or find a ride. And then you make it to the doctor's office. And then there's more waiting, right? There's forms to fill out. There's waiting in the waiting room at the doctor's office where everyone else is coughing around you.
Yeah, right.
Yeah.
Then you go and you sit in the cold room of the exam room, and there's more waiting until you see your doctor, right? Or your nurse practitioner. And how long does the doctor spend with you? If you're lucky, 10 minutes.
Yeah.
If you're lucky, 10
there seems to be a time clock ticking in his mind. I've only got so many minutes that Medicare will pay for, that my practice will allow, or whatever. Here, I got so many people waiting. Yeah.
And if you map out that process from the initial phone call to that physician's visit, where is the value to the patient in the entire process? The value is the last 7 to 10 minutes.
Yeah.
Right.
You can cut out all that stuff through telemedicine.
It's true.
And nobody has to, you don't have to find a ride. You don't have to, wait in the waiting room. When you're ready for telemedicine, you click on and the doc's on the other line.
How about just the fact that this used to frustrate me, that, and I don't know if this concierge program helps in any way, but by having all the records someplace that everybody could see them, I can't tell you the number of times I took my aunt or my mom or my dad from one doctor to another, from one specialist to another. And if they weren't in the same healthcare system, they couldn't go on and access the same computer. And I'm having to bring the records. I'm having to go show them the x-rays and other things here. I'm having to go collect and pass this stuff around. I thought that was nuts.
Yeah, it is. It's very challenging. And so that's one of the reasons we developed this program, and it's actually affordably priced. It starts with a 30-minute consultation with our gerontologist to understand what the patient's needs are. And then if someone is just starting on the caregiving journey and wants to understand, okay, how do I do this? We'll offer a Zoom call, or once we're past COVID, you can come into our office and meet with our registered nurse to talk about your care needs. So that's 2 hours of service. That's at $195 for 2 hours of service. And when you leave that appointment, you've got trusted referrals, vetted referrals, recommendations from us on how to begin that caregiving journey. And you're armed with the information that you need to start off successfully. Other folks like to have what we have as an advanced program of 6 hours of service, where our registered nurse goes out to the home or wherever the venue where the older adult is, meets with the family if they've got family, and talks about, okay, what are your activities of daily living? We look at cognition, we look at safety, we look at medications, and then we also confer with the doctor and other healthcare providers. And then from there, we develop this online care plan that, of course, we share with the family with these medical and non-medical goals. All of the case management notes are in this care plan. All that information is right at a glance. And then as progress is made against the goals, then we update the family by email and text, so everybody's all on the same page, regardless of where they live. And what this ultimately does, it can reduce costs because you're not running to the emergency room 20 times, yes, right? Because a crisis has now happened. We're staying on top of keeping that older adult healthy. That reduces costs and saves enormous amounts of time because you're not in a panic, trying to figure out what to do. So that's why I like to think of it as aging reimagined. Imagine having a registered nurse at your side, or that you can call when you need help and support. And that also helps to foster family communications, because one of the things we've seen is, when you come back together as adults to care for mom or dad, maybe some of those sibling rivalries, which have lain dormant for long,
yes,
right?
I've seen
you see
that.
this?
Right.
And so this is one of the ways that a registered nurse who's objective, who's not involved in all the dynamics, can say, wait a minute, let's put the older adult first. Let's put mom or dad first. That's who let's get together as a team and focus on their
I'm an only child, but my wife had two sisters who they've always been competitive with each other. And oh my God, as mom was aging, not dying, but just aging in her home, they were always arguing, well, mom wants this. Well, no, I think we should do this and everything. I was like, oh, would you guys just stop already here? But they all want to be the good child. They all want to take charge, and they all think they know what's right. And well, I think this is an incredible program. I wish this had been around years ago when I went through all these challenges myself. How do people find this? How do they get in touch with you? And how do we get you back to tell more?
Well, we have you can call our main lines, and I'll give that information in just a second, how to reach us. I've got one more exciting thing I want to tell you about.
All right.
This is called our Smile Makers Station. We have just launched this. This is used in long-term care facilities to reconnect older adults with their loved ones. We call it Connecting Hearts and Hands. So we just rolled this out right before Valentine's Day in a care facility in Anaheim and another one in Riverside. So this is a polycarbonate center panel with gloves in it, and you can actually visit your loved one. You can hold their hands. You can hug them again. This is so awesome. We are just so delighted about this. We're going to manufacture another 25 of these and we're giving these away to skilled nursing facilities in Orange and Riverside County. Here's some these people are holding their loved ones' hands for the first time since the pandemic.
Can I tell you one of the simplest gestures that my mom and my dad and my aunt all wanted is just to have somebody touch them, because as they get older, nobody touches it. The nurse touches you, but nobody else. Everybody, I don't want to hurt you. I don't want to get anything. Right. I don't know. I feel uncomfortable, and nobody, more and more, we recoil from touching and hugging them.
But think how great it feels to, actually hold someone's hand and to be able to do that. And this is so important. And in fact, when we were just trialing it at the prototype, after we had it built, we actually got staff members who got to hold one another's hands. We're like, oh my God, we haven't done that in so long. And so when we saw the faces of these folks, and just the mother back in this first picture, when she got to hold her daughter's hand, she just said, I love you. And then she just kept thanking us. It was just like nonstop, thanking us because she was so delighted that this happened. So we're really excited about this and very excited to bring this to the community.
I
So
had no idea you did so many things for so many
we
people.
we are very busy. And we've also got an Aging as Art juried photography show that's going on now. It's on display actually right now at John Wayne Airport in Terminals A and C, but we've just gone international. And so we are looking for entries from amateur and professionals for this photo contest. And it'll appear at the Bowers Museum, Newport Beach Central Library, and now the Ontario Airport in 2021. So we are busy.
I think you are too busy to be on for 1 hour here. We got to get you to come back. There was too much stuff we're trying to tram. You're overloading me with ideas and
We've
information.
got lots
here.
of things to talk about.
And
Happy to
stories
come
to
back
share.
and talk to you.
Let's definitely do this. How do we reach you? Where's the Council on Aging Southern California? The website is
www.coasc.org.
Well, you're the most prepared guest we've ever had on. You had a presentation. You had slides. Every time we cued you, I got a slide for that. Let me show you here. I love it.
I love talking about older adults. I love helping older adults. I got a wonderful staff, tons of volunteers, and this is just what we do all day long. And I'm so grateful to Dr. Trin for inviting me on this show. Thank you so much. And to you too, Paul. This has been fantastic.
Well, hang on afterwards because I'm going to talk to you about some other opportunities. I think we could maybe help you tell the story of this.
So, Lisa, have you there are many health organizations, medical groups where, we physicians are like, we don't know where you should go to ask these questions and you have, these resources that we don't. Have you considered just partnering with medical groups to kind of plug into a medical group's program and services as a plug-in to
as
provide
a partner with some where they just immediately go, you got a question, call these folks, call this program.
Well, I'd certainly love to talk with you further about that idea. There's a lot more that we can be doing to help get the word out there. We've been around here in the county for 48 years. And so we're here to, help seniors remain healthy, connected, and protected. And I'd love to talk with you more about how we could possibly partner together, or ideas that you have, Dr. Trin, and you too, Paul. Happy to be of help. But the main thing is just call us. We have operators that answer our line live. And so unless we're bombarded with calls, but typically
operators
we can answer the calls
standing
live.
by right now.
Yes, we're just happy to help. That's what we do. And if we can't help you, we can typically refer you to somebody else who can. So please call us. We're happy to help.
I'm happy you were here today. I'm happy that you're going to come back, and I'm happy to give you some other ideas. If you'll hang around after this, we get off the air here, I'll give you some other quick ideas. I think Dr. Trin's is a great one here. Well, thank you so much. Take us out, Dr. Trin. I know we
All
were.
right. Thanks so much, Lisa.
My pleasure.
Amazing service that you're doing to a group of folks that are often, not on the front lines because when you get older, you end up in a nursing home and you're forgotten. And so you guys are out there. I love it. Just love it.
We can do a lot to help folks stay healthy at home and stay safely at home for as long as possible. So that's what we'd love to do. Absolutely.
At home. Yes. Love that.
All right.
Yes.
Hang on, and we'll tell you some more ideas. But for those of you live, you've been listening to Health Talks with Dr. Trin, the one show, the only show that shows you information like this, that guides you where to go to get the facts, figure out how to live a healthier life for as long as you can. All right here, only on Orange County's only community radio station, octalkradio.net.